Hi, I'm Dr. Mike Datola, and I'd like to take a minute to share with you my favorite way of doing interproximal reduction. It's with the IPR strip system from Contact EZ. Since aligners were first introduced to dentists and patients nearly 20 years ago, they've continued to grow in popularity. But for most aligner cases to be successful, it's necessary to do some IPR or interproximal reduction because of the lighter forces involved with orthodontic aligners when compared to traditional orthodontics. The IPR strip system allows you to accurately remove the necessary interproximal tooth structure and to do it in a safe and predictable way that prevents sharp tooth corners or subgingival ledges and preserves natural tooth contours. This truly is stress-free IPR, so let's go ahead and take a closer look at the IPR strip system. So to look at the IPR strip system, this is a pretty typical case of a patient who might come into your office and ask about having removable aligners done. It's pretty typical because you see more crowding in the lower anteriors than you do in the upper anteriors, and it's usually this crowding that's going to be the most difficult to take care of in the lower anteriors. And if you have a digital treatment plan done, they'll usually tell you exactly how much interproximal reduction or enamel stripping you need to do between which pairs of teeth and where it needs to be. And as you look down, you can see we're definitely locked out with our lateral incisors, so there's going to need to be some stripping there. And they'll tell you, 0.1 millimeters, 0.2, 0.3 millimeters. And so that you know exactly the goal that you're kind of shooting for. And so there's a gauge system that allows you to actually measure if there's an opening already, and then you can check your progress as you do the interproximal reduction. So if they ask for 0.3 of a millimeter between teeth, let's say 27 and 28, you can create that space and then put this gauge in and ensure that you actually got to that 0.30 millimeters of space between those two teeth. So before you start it, it's probably always good to just check with the 0.10 and see if in fact there is any space between those teeth like there is here. So I've already got 0.10 between the central incisors. So if that's all they wanted in there, I would leave that be for now. But on some of these other ones, it's much tighter. So this is the IPR strip system itself, these 4 strips. And we always start with the yellow one. This is the starter strip. This is 0.07 millimeters in thickness. It's single-sided, so you can see that it's got diamonds on that side, and then it's shiny and perfectly smooth over on this side. So this is an extra fine diamond grit because we don't want to remove any more than 0.07 millimeters. And it's also serrated, so I can feel down here and feel that there's a serration here. It's the only one of these 4 initial strips that is serrated because there's definitely times where you need a little bit of help getting between these tooth pairs. So I might start between these 2 teeth, and basically we just want to move it buccolingually. So you hold on to it and gently we're going back and forth, moving it buccolingually until the strip is passive. We don't want to use vertical force. We're not taking our other finger and pushing down here and trying to saw through a contact, and we're really not even leaning kind of down on it like this. We're simply going buccolingually and letting that little serration on the edge help us find that pathway down in between that contact. So we're going back and forth as we can do it, as we do it, and then we can come out and verify that we have in fact removed that much. And remember, it's just cutting on that one side as well. So as you're in there going back and forth, you wouldn't pull the smooth side against this tooth. If anything, you would move a little towards this one, knowing that this is the tooth that you're actually removing some enamel on as you go back and forth inside of that contact. These are all sterilizable, by the way, so these can be autoclaved, and they're good for, the company guarantees them for use up to 5 times. There's probably dentists who use them more times than that, but diamonds tend to get clogged, as you know from prepping teeth. And as a result, they're at their maximum efficacy for 5 uses. So that's the first one, the 0.07. The next one is the red strip, which is a 0.12. This is a medium diamond, and again, because it's a bigger diameter, it's actually double-sided, so both sides of this one will cut. And then we go to the 0.15, the blue double-sided coarse diamond on both of those, and these are not serrated because we've already created the path with our yellow one. And then we have the green extra widener, double-sided, 0.2 millimeters, and a double-sided coarse diamond. And we could probably sneak this in. These teeth aren't real teeth, obviously, so it's much easier to be able to sneak in somewhere because we have a lot more deflection within this plastic base than we do with the PDL. But you can see, like when you do it in the mouth, you start to get some powder accumulating on here as you go in between there. And if they were asking for 0.20 millimeters, we would then take our thickness gauge for the 0.2 millimeters and put it between those teeth to ensure that we had, in fact, removed enough. And the digital treatment plan will typically tell you when to make these adjustments, when to do the IPR, and have these measurements as you work your way through. And then the IPR Plus kit has some additional strips for some bigger ones. So it goes up to, you can see the numbers on some of these, the 0.35 millimeters, 0.4 millimeters. So the more crowding you have on lower anterior teeth, for example, the more reduction you're going to have to do to get through there. And again, these are all coarse diamonds and double-sided and don't have any serrations as you get deeper into the IPR process itself. You can see this opening that's here. It's there for a specific reason. It's really about visibility. So as you're going in here, you can see where this tooth is, and as you lean it back and forth, there's a bit of flexibility in your ability to lean it one way or the other. So that central opening ends up being really handy. And because there's no serrations on any of the strips except for the very initial one, it prevents any sharp corners or subgingival ledges. There's definitely people who like to use a rotary disc and a handpiece to do this kind of IPR, but it can be a little more stressful and a little more dangerous. And I think the most consistent, easiest, and certainly the safest way to do it is with these hand strips. And it doesn't take a long time to be able to go here and do it. And when you have a cookbook or a recipe from a digital treatment plan telling you what to do and how much space to create, the IPR strip system makes it simple and easy to follow that logical step. Anytime you can make a procedure in dentistry stress-free, it's worth doing. And the IPR strip system has made interproximal reduction stress-free for me. So on behalf of myself and all of us here at Contact Easy, I want to thank you for your time and your continued commitment to quality dentistry.